Palmer, Dr. Mama Bear, coming to you live from Florida on Menses, Motherhood and Magic. Menses, Motherhood and Magic. A lot of women don't talk about menses, our menstrual cycle. We don't talk about those things, right? I remember my mom was a little bit shy about it. She gave me a book to read. I remember being in 6th grade, getting separated. The boys were in one classroom and the girls were in another classroom, and they were trying to explain, the 6th grade teachers were trying to explain the best they could about a female menstrual cycle. And so one of the things I've done as a mom, but also as a doctor, is try to explain normal functioning of the body to my daughter, whether she's 3 years old, 6 years old, 8 years old, whatever she has questions on, just make sure that communication stays open. So when she's older and she gets her menstrual cycle, she knows what it is and she knows what to do and she knows that it's natural and she knows that's a part of going through puberty and changing, right? The problem is in this country and worldwide, a lot of women don't know what a period should look like. They don't know what a healthy menstrual cycle should be like. They think a healthy menstrual cycle is cramps, heavy bleeding, clots, getting emotional, feeling bloated. Those are all signs of a not healthy menstrual cycle. Those are signs of imbalance of the hormones. Now, in natural health care, I'm a natural health care physician. I'm a doctor of chiropractic. I've studied hundreds and hundreds of hours of different nutrition and applying nutrition to the body as far as vitamins, minerals, electrolytes, herbs, to not cure the body or treat the body or diagnose the body, but rather naturally rebalance the body. And with doing that, what we see, and so cool, is we see that women, they don't even know when their period's coming because the cramping's gone, the bloating's gone, the tender breast is gone. They just end up having a cycle. And what a cycle is that uterine wall sheds. It comes out as blood. It shouldn't have, not to be graphic, but it shouldn't have chunks or anything like that. And then it goes away and the cycle continues and physiology continues. And if there's anything other than that, that just means there's an imbalance. The imbalance could be due to a chemical exposure. I was just at a conference and one of the presenters was talking about a chemical in our water supply called atrazine. And atrazine can negatively affect the thyroid. It can negatively affect hormones. It can make a female have more male attributes. It can make a male have more female attributes. And actually, Dr. Hayes studied the negative effects of atrazine on frogs and found out these frogs that were green frogs were turning into brown frogs, or frogs with no spots were turning into frogs with spots, and female frogs were turning into male frogs, and male frogs were turning into female frogs. So very interesting hormonal changes with just that one chemical in our environment. Now there's chemicals in the air we breathe, the water we drink, the food we eat. I was talking to a gentleman today, and he's like, yeah, I was working with a practitioner, and this practitioner was a natural practitioner, and they were saying that nightshade vegetables can cause inflammation in the body. And I'm like, yeah, you're absolutely right. They can, like potatoes or peppers or whatever. I go, but what also can cause inflammation in the body, and what also can cause problems with knees and increased rates of anterior cruciate ligament damage, and even damage in dogs' knees. Like, back in the day, when I first started in practice in the early 2000s, I never heard about dogs blowing out their ACL ligament. And, back when I first got into sports medicine in the 90s, anybody who injured their ACL ligament, it was a contact injury, right? A big football player and a big football player came together and their knee got pushed backwards. That ACL ligament, so the anterior cruciate ligament, keeps the knee from coming forward, right? And so if you get hit and that ligament tears, your knee will slide forward, right? There's actually an orthopedic test called anterior drawer, and you pull the person's lower leg, holding their calf, you bring it forward, and if it gaps, it can be because there's a tear in that anterior cruciate ligament. Well, I always was wondering, why are we seeing an increased rate of tears in the anterior cruciate ligament. In the 90s, it was mainly contact, and then in the late 90s and early 2000s, you could have a soccer player running down the field, they go to turn. You have a football player running down the field, they go to turn. You have a basketball player running down the court, they go to turn. And then all of a sudden, it's like a sniper shot them, and they're on the ground holding their knee. You might even hear a big pop. What caused that knee to blow out? No one hit them. No big football player landed with another big football player. They just changed direction, and the ACL popped. So what the heck causes that? There is a chemical in our environment called Roundup. The chemical component, that's the brand name, the chemical component is glyphosate. And glyphosate actually changes and weakens the cartilage. That could cause an increased rate of anterior cruciate ligaments. That glyphosate component also contains antibiotics, which can destroy the gut, which can also have a negative effect on hormonal balances, causing problems with menses, causing problems with menstruation. As a soccer player, I was on fields all the time for decades. As a soccer player myself, I played for 30 years every single season, but also as a doctor, a team doctor on sidelines. And unfortunately, a lot of those fields are sprayed with Roundup because they don't want weeds on the soccer field. On one hand, you have a beautiful soccer field with no weeds. On the other hand, you have exposure to nasty chemicals. And those nasty chemicals, you inhale them. If you sit on the grass, you can get glyphosate through the wet grass, touching your bare skin or your soccer shorts or whatever. And they can get into your system and weaken the joints, making you more predisposed to ACL injuries, joint injuries, wearing out of the knees, wearing out of the hips, and then imbalances in female cycles. And so for me, being a soccer player, I would have a menstrual cycle, and then I would skip 3 months. I would have a period, and then I'd skip 6 months. I would have a period and then skip a month. And I went to the OBGYN and I said, look, I have really irregular cycles. I don't ever know when they're coming. It's just kind of like a surprise, here I am, which is not really what you want. And so the OBGYN solution was, well, I can put you on an oral contraceptive, and birth control or oral contraceptive can help to regulate your periods. Well, that wasn't true, because when you're on an oral contraceptive, you don't have a period, you have a bleed. And it doesn't fix the cause of the problem. It suppresses the outpoint. It suppresses the irregular periods, right? By having breakthrough bleeds. And then the OBGYN didn't tell me that oral contraceptives lead to increased infertility rates. It can lead to increased rates of stroke, increased rates of blood clot, increased rates of ovarian cancer, increased rates of cervical cancer. She didn't tell me any of this stuff. And so not knowing a solution, not really being into natural healthcare yet, I was in sports medicine at the time. I took the oral contraceptive. I gained 20 pounds. My breast size increased, which is not good when you're an athlete because you got to run with those things. I felt completely emotionally different. I felt very quick to be sad and quick to be, just didn't feel myself. And so after a couple months, I'm like, this is not fixing the cause of my problem. I don't want to take this stuff anymore. And I do want to have regular menstrual cycles, because that means that I'm a healthy female. If you don't have a healthy cycle, then you're not a healthy female. You're not supposed to have those symptoms. You're not supposed to have PMS. You're not supposed to have bloating. You're not supposed to have tender breasts. You're not supposed to have irregular cycles. You're not supposed to have hazy, heavy, crazy periods. And if you have those, you have an imbalance. And so with the technology that we do in my practice called quantum nutrition testing, we look for the cause. And that cause can be chemical, could be a chemical exposure like glyphosate, which we're all exposed to right now. It could be a heavy metal toxicity coming from things that happened earlier in your childhood, like shots. It could be mold exposure. Maybe you have a wet, leaky basement. Maybe you had hurricane damage. Maybe you had a flood in your house, and that mold can imbalance hormones. And so we look to identify what caused the imbalance, and then we rebalance the body using vitamins, using minerals, using herbs, using carbon technology. And so for me, when I had the irregular periods, the birth control was not fixing the cause of the irregular periods. It was just suppressing one of the symptoms and causing a whole bunch of other symptoms and side effects. And it wasn't until I got into nutritional work, and specifically at the time I was into another technique called nutrition response testing, that I was tested and I found mercury in a gland in my brain called the pituitary gland. The pituitary gland, some of you guys know the other name to that is the master gland, is responsible for so many different endocrine functions in the body. And by using whole food supplementation from a product, from a company called Standard Process, detoxed the mercury out of my system, supported the pituitary gland, and my periods started to normalize for the first time in my whole entire life. And I was so happy because I was like, this is a healthy female body. And then this wonderful man, some of you guys know him, Dr. Jason Dean. And we decided that we wanted to have a family. And I was concerned because I had a prior history of irregular periods that I wouldn't be able to get pregnant. And because of the work that I did nutritionally, and because I learned how to eat properly, because I thought as a soccer player, I could eat like cookies and candies and ice cream and drink alcohol. And as long as my body looked good on the field, as long as I was athletic and trim and had low body fat, that was the definition of health, right? Most of society thinks that is the definition of health, is if you are in a good weight and you have good muscle and you look good, then you must be healthy. But there's people that run marathons and they're in good shape and they drop dead of a heart attack. Are they really healthy, or is there a different definition of health that we need to apply? And so working on my food and learning that, it's not just what you eat, it's also removing toxicities from the body. So I did a lot of work in handling mercury toxicity. I did a lot of work in handling high parasitic load. I did a lot of work in handling a mold toxicity. We had a leaky roof in one of the houses I lived in. I didn't know until it started raining from the ceiling. And I'm like, oh, we have a problem. That my periods became healthy. We're not heavy. We're not irregular. We're not crampy. Just I would have a bleed. And then when my husband and I decided that we wanted to start a family, I was able to get pregnant very, very quickly. In his words, he was hoping to practice more and have a beautiful, so the mothers out there, happy Mother's Day. Have a beautiful 10-year-old daughter now. I'm so proud of her. She is an awesome young lady, a great gymnast, works hard in her homeschool work, loves to learn nutrition and muscle testing, and has a heart and a passion for helping animals and dogs. I asked her, Leah, how many dogs would you love to have? And she said, I'd love to have 1 million dogs, Mommy. And I'm like, okay, well, in the future, maybe you could have a pet rescue, or you could help dogs naturally and that kind of thing. And so if you are suffering from, irregular periods, heavy periods, PMS, infertility, maybe you have some kind of weird condition and the docs just don't know what to do, not because they don't want to help you, they just don't have a solution for you. Then what we do, the last part of the title of this live is magic. What we do seems like magic. Now it's not really magic, right? I'm not like Harry Potter with a wand, although I would love to have a magical wand to just wave away people's problems. I don't have that wand. If you do, let me know your supplier, right? But it's magical in that when you find the cause of the problem, whether it's mold or parasites or chemical toxicity, metal toxicity, you handle the cause with whole food supplementation, positive lifestyle changes, that person starts to heal and it's magical. And then their PMS symptoms go away. They have more energy to play with their kids. They can, if they're a student, they're able to study better. They have better moods. They can think more clearly. And so if there's an out point, if there's something that you need help with, reach out to me. You can direct message me. You can ask me questions in the chat. I see, hey, Gary's on, Katrina, hey, Ann. Hi, everybody. If you have a question, pop it in the chat. I'm happy to answer it. And know that there is a solution to your problem. Now, I'm not going to lie to you. It's going to take work, right? It means that you can't eat cookies every day. It means if there's things in your system that are not balanced, we're gonna work together. I'm going to hold your hand. We're going to help you to balance that. But it's not magic in that it happens overnight. however many decades it took you to get to this point, the good news is it's not going to take that many decades for your body to heal, but we have to be realistic in our expectations. There is not a magic wand, and that the time it took to tear you down to get you to this point, in Florida, I like to use the example of a hurricane. So was it like a category 1 hurricane where maybe some trees fell down in your backyard and we have to clean that up? Is it that you had some flooding in the house? Is it that part of the roof ripped up? Or was it like the whole house got demoed? So the more severe the damage is on your body, then it may take a little bit longer time to help your body rebalance, to help your body rebuild, to help your body repair. And if you need my help, I would love to have one of my practitioners reach out to you. I would love for them to sit down with you for a consultation and really get into conversation with you on what is the problem. Then we quantum nutrition test what is the best program for you. We look for the cause, we give you a report, and then we help you along the way. And so if there's something I can help you with, please reach out to us, Palmer Natural Health. If there's something that is not optimum in your life, there is hope. There are solutions. And we're happy to look to see if we can be part of your natural health care team. I'm Dr. Lisa Palmer, Dr. Mama Bear. Would love to help you. Happy belated Mother's Day, everyone.